So I think one of the very first things that's already begun is communication, and to be science and public health based and talk about federal policy. As Bob said, we need a national policy. We don't need a crazy quilt of state by state policies. And this is beginning already to be started. Emphasizing public health and scientific principles and providing sustained, clear, continuous communication, I think is very important. Number two, they're looking very hard at the vaccine distribution. We say that there's a lot of vaccine out there, but we've also run into vaccine distribution problems, and we need to smooth those out so that if you're running a clinic, you can be assured that the vaccine you need is there when you need it. Because if you have to turn people away who've had an appointment, that makes everyone grumpy. That doesn't help at all. And then I think we need to reinforce that we're doing this together. Turning things around from the disparate ways we've approached COVID generally at the state and local level, and instituting a federal level program so that there's more consistency across the country will be a little bit like turning the proverbial ocean liner. It will take some time and it will take persistence.
The new administration already has designated many of the key leaders for these roles. There are a couple more coming, and they're terrific. I mean, they're smart. They're good communicators. They understand and are able to communicate the science. And so I think you're going to start seeing, daily press conferences about how this is going and problem solving, and more forceful recommendations to the states about how to do this. More funding. Some of that they will take credit for actually was passed 2 weeks ago, 3 weeks ago, but it will start making it out into the field. And as I've written, I had a piece in the New York Times this weekend, I'm favoring a much more simple allocation system that in the end of the day includes lotteries or random allocation. I just worry, as we open up to more groups, and we've lowered the age now to 65, you start having cohorts of tens of millions of people who are now eligible, which I think is good. I think you want to open it up to the degree possible. But if they are all calling into one phone line, that's not going to work. If they're all trying to go onto a website, it will break. Or you could say, all right, line up for your vaccine, and you have a dumpster fire like we saw in Florida with people with their walkers on a 5-hour line, overnight, looked like they were waiting for a Springsteen concert. It can't work. So you need some way to say, here's a large group of people who are eligible, and how do we divide them so that it's fair and transparent and easy to verify.